of melatonin. So this is melatonin in nutshell. Now melatonin, one of the study has shown that 1 year of melatonin supplementation in postmenopausal women brings the weight loss in obese postmenopausal women. Properly conducted study. So melatonin has a role in obesity also now. Now various mechanisms, because melatonin is suppressing your cortisol, melatonin is improving your IGF-1 growth hormone, melatonin improving your sex steroid, melatonin is giving you a good sleep, so neurotransmitter control is there. So many things melatonin is doing. But as an independent entity is also working on the weight management. So that's one thing. Now second thing about melatonin is now in osteoporosis. By acting on BMPs, bone morphogenic protein or peptides, it is working on them. Very well studied. The third is melatonin decreases adipogenesis in the bone marrow. And fourth is, along with DHEA, growth hormone and melatonin prepares the seed of or the soil for the stem cell therapy. So many roles of melatonin which are proven. Okay, now melatonin is no more theoretical, and the most common which is indicated is jet lag. Now we all are frequent travelers, right? And in current, with acculturation availability, we all travel transmeridian. So we all face jet lag at some point of time, and melatonin is the drug of choice for jet lag. Okay? So drug of choice for jet lag, so drug of choice for social jet lag, drug of choice for vague symptoms in a patient having biochemically other parameters to be normal. Try with melatonin, patient may improve. Okay, strongest antioxidant nature has given us.
Dementia, can you prescribe dementia?
Dementia, prescribe whatever. Prescribe whatever you want to prescribe. But dementia also should have some cause, right? You can prescribe. But again, dementia is not an indication for melatonin. See, in our prescription, it is always like that. There are only 1 or 2 drugs which are actually indicated in that condition, rest all are supportive. Okay? So same here in dementia.
Sir, one more message.
Sir.
In radiology, if repeated for more than 5 skull aspirates, the pineal gland gets
Atrophied.
atrophied, now calcified.
Calcified, na? See.
So naturally,
They need melatonin.
they have to orally test.
They should. I will write it down. Very important. So if somebody like 4 to 5 episodes of X-ray skull, the pineal gland gets atrophied. So these people are like a strong indication for melatonin. Very nice, sir. I will mention that. See, this is a very nice. That's how anti-aging is all about. Radiology, gynecology, medicine, everybody comes together. A beautiful this.
Single CT head.
And CT head? CT? CT scan?
CT is magnetic only. No, I mean CT is radiating.
CT is radiating.
Also sometimes.
Yeah, it may. But X-ray definitely he's telling 4 to 5. 5 times if somebody has done right.
In radiology, there are so many facts also that because if a man or the lady becomes sterile, it is because of the radiation hazard.
Radiation hazard. Yeah, it's radiation hazard. Important. I'll note it down. You also note it down. It's so even they become a spectrum. We should tell every radiologist that if somebody has done 4 to 5, please consider and at least follow up with them. If they are having any sleep issues, they are having any other circadian rhythm issues, any sexual issues, and they may be helped by melatonin. Maybe. We have already spoken. Melatonin may be in future, it can be an interesting therapeutic agent with possible bone formative as well as fat reducing properties, including the regulation of glucose and lipid metabolism. You can think about if it really comes out to be true, which already studies are showing, melatonin will come in the regular practice.
So we can,
Orthopedics, yes.
so also we can then prescribe in patients with diabetes mellitus.
Yes, we do. We do that.
After this rehabilitation, like tobacco rehabilitation.
Yes, you can. For any rehabilitation. Melatonin actually can be prescribed because there is no absolute contraindication for melatonin. And it is not an addictive drug. It is not addictive. Even somebody taken melatonin for 2-3 months, stop it, no problem. It will come back to the same what it was. I mean to say sleep and other issues. Not like benzodiazepines where abusive potential is not there with melatonin. Okay, but very good point is, in future it can be an interesting therapeutic agent with possible bone formative. Very interesting. None of the other hormone is showing that. It is equivalent to stem cell then, right? As well as fat reducing properties, including regulation of glucose and lipid metabolism. A wonderful statement. Jet lag, we have already spoken. Symptoms, I am not talking. Aesthetic manifestation of melatonin deficiency, premature aging features, features of any endocrine disturbance, and bags under eyes, the eye bags. Aging features, sleep difficulties, intolerance to jet lag, mood memory issues, or any endocrine disturbance features are amplified if there is melatonin deficiency. So indications of melatonin therapy: circadian rhythm disorder like jet lag, stress, mood disorder, CVA, sleep disorder, immune disorder, component of menopausal, andropausal, somatopausal, HRT, age-associated mental decline, very good antioxidant as an immunity enhancer in various immunodeficiency states like HIV, even diabetes is immunodeficiency state, fibromyalgia, osteoporosis. Now already it has been shown that skin aging, supportive therapy in cancer management, supportive therapy in Alzheimer's, and as an adjunct in the regenerative medicine, and also now supportive therapy in obesity. Contraindication, no absolute contraindication.